Welcome to our mnemonic video on diffuse abdominal and flank pain differential. Let's get started. This scene will take place at the county fair. Off to the right, we can see one of the stars of our fair, the strong man. This strong man, however, looks like he's having a rough time. He's doubled over in pain as a kid kicks him in the abdomen. His sore red abdomen and flank should remind us that this story is all about diffuse abdominal and flank pain. Here comes one of the game operators. This game operator has gray hair and is smoking a cigarette. He has seen many county fairs in his day, and these new high-tech fair games are more than he can handle. Just look at how the AAA battery from his electronic game controller is exploding. An exploding AAA battery is a recurring symbol for a ruptured abdominal aortic aneurysm, or AAA for short, the first on our differential for diffuse abdominal pain. Risk factors include smoking and old age as depicted by our game operator. A ruptured AAA is an emergent, life-threatening condition and should be quickly ruled out in any patient presenting with diffuse abdominal pain, as it can quickly lead to hypotensive shock and death. No fair is complete without some greasy, sugary fair food, and this county fair is no exception. Here we see a man chugging a sugary, acidic lemon shake and a bottle of overflowing syrup. The overflowing syrup bottle is our symbol for hyperglycemia, while the lemon is our symbol for acid. Also notice that this guy is wearing a necklace made of dyed beads, our symbol for diabetes. And if we look closely, we can see some lemon in his diabetic necklace, which is here to remind you of acidity. So putting all these things together, diabetes and acid should make you think of diabetic ketoacidosis, which is often referred to as DKA. DKA can present with diffuse abdominal pain and is a life-threatening complication of type 1 diabetes. The treatment involves administration of insulin, potassium supplementation, and plenty of IV fluids. All right, let's turn our attention over to the balloon arch on the left. Notice that this balloon arch resembles a large bowel and is surrounding an arch of veins at the entrance to the fairgrounds. The veins represent the arterial arcades supplying the large bowel. A man is trying to water the veins as half of them are looking dead, but his red water hose is clogged. A red, clogged hose, our symbol for an occluded artery, which then causes some leaves to die, should make you think of a dead bowel resulting from a clogged artery, a condition known as mesenteric ischemia, which is another life-threatening cause of diffuse abdominal pain. These patients often are described to have abdominal pain out of proportion to their physical exam. Therefore, you should always suspect mesenteric ischemia in the setting of diffuse abdominal pain until it's ruled out. It looks as if a clogged hose is not the only thing going wrong with our arched entrance. The large bowel balloon arch has developed a few leaks and is deflating as a result of multiple perforations. The perforated large bowel balloon arch should remind you of a perforated bowel, or rather a perforated viscus, which is another cause of diffuse abdominal pain. This condition is important to recognize as it can quickly lead to sepsis if not promptly treated. Treatment involves prompt surgical correction and prophylactic broad-spectrum antibiotics. All right, now let's turn our attention to the soup stand in the back. Notice the small bowls stacked on the counter and the large rock placed on top to keep them from blowing away in the wind. A small bowl sounds like small bowel, and the large rock in the small bowls should make you think of a small bowel obstruction, often abbreviated SBO. SBO is a cause of diffuse abdominal pain and can be a result of many conditions like tumors and postoperative adhesions. Therefore, the cause should be investigated and managed accordingly once SBO is diagnosed. You can't rely on food to be safe at this county fair. This is evidenced by the man experiencing vomiting and diarrhea while eating a bowl of soup. We use vomiting and diarrhea stain to represent acute gastroenteritis, a common cause of diffuse abdominal pain, which is often treated supportively with complete resolution. All right, now that we've covered the differential for diffuse abdominal pain, let's move on to the differential for flank pain. In the middle of our scene, we see a mischievous kid throwing stones at a passerby. Looking closely, we notice the stone is shaped like a kidney and is hitting the passerby in the flank. This idea should make you think of kidney stones or nephrolithiasis, which is a cause of flank pain. Not only is the kid equipped with stones, he's also waving flaming pipes. Flaming pipes are a symbol for pyelonephritis, another cause of flank pain. It often presents as flank pain with fever and can result from an obstructing kidney stone or an untreated bladder infection. Either way, the treatment involves hydration and antibiotics. Although everyone seems to be having a great time at the county fair, there's always one person who doesn't know what's going on. Just look at this guy in the pink shirt holding his abdomen in pain. He's eaten too many things and looks unsure about what caused him that pain. There's even a question mark on his abdomen that indicates uncertainty. Let this confused guy with a belly question mark remind you that non-specific abdominal pain is a common diagnosis for both diffuse abdominal pain and flank pain. There's not always an obvious cause for pain, but that should not deter you from exploring all of the differential diagnoses we've discussed in this story. And with that, we know all about the differential diagnosis of diffuse abdominal pain and flank pain.